Hello, everyone. I'm Kevin Kunzman, Managing Editor of HCP Live, here for another virtual conference video interviews, part of our remote ASRS 2020 coverage this year. Today, I'm joined by Dr. Geeta Lalwani from Boulder Community Health, who is presenting this weekend as part of the virtual sessions for ASRS, insights into the progression of diabetic retinopathy severity among primary care patients with diabetes in the United States. Obviously, an increasingly pertinent topic in our U.S. population, and something that I think really expands discussion beyond most of the general ophthalmology discussion that we're having this week. So before we get into that, first and foremost, Dr. Lalwani, how are you doing?
I'm doing well. I'm zoomed out, but appreciate you reaching out regardless.
Yeah, I'm there with you. My preference is always in person for this kind of thing, and certainly meetings like ASRS have a more fun vibe to it when you're there in person.
Sure. Really looking forward to seeing you and everybody else in person again.
Yeah, one of these days. But for now, this will do, and I think the virtual platform we've been given to discuss some of these posters and presentations is just really great, and yours really stood out to us in terms of interest for our more broadly encompassing audience. So if you don't mind, Dr. Lalwani, can you give us, I guess, the elevator pitch of the significant things from this?
Sure. So we as retina specialists are well aware of the impact of diabetic retinopathy on vision, particularly in the working class population. In this study, we had access to a database of a retinal screening program that was done at non-retina locations. Patients' fundus photos were collected, the typical 7-field color fundus photography. We started with something like 73,000 patients, but then through various limitations ended up with 22,000 patients, 44,000 eyes that were followed over a period of about 5 years. Now, the requirement was that we had at least 2 different time points for each patient. This allowed us to look at the progression of diabetic retinopathy, specifically a 2-step progression, as well as the development of CSME or PDR based on fundus photography. Obviously, when you're talking about a database of this size, there are some limitations, very heterogeneous screening frequencies. Unfortunately, we didn't have diabetic control measured at baseline. However, in looking at it, we were able to see what, some of the data which we knew to expect is that over 5 years, if you looked at the total population, you had about a 10% progression to 2-step worsening. However, if you focused on patients who had moderate to severe NPDR at baseline, you had a 35 to 40% progression rate at 5 years. And this is very similar to what we've seen in some of the sham studies, specifically RIDE and RISE in the sham population. What we found interesting, however, was that when you looked at the total population, you had a percentage that developed either CSME or PDR or both. And more people developed either CSME or PDR than both together. And so we want to exclude the fact that this was just related to severity of diabetic retinopathy. So we again focused on patients who had moderate to severe NPDR at baseline and found exactly the same thing. Patients tended to develop either CSME or PDR, and a much lower percentage developed both. This was interesting to us. It almost seems like there may be 3 separate populations that are developing, if we could identify characteristics, go on to develop a different type of diabetes or subset of diabetes, diabetic retinopathy.
That's fascinating, and it kind of alluded to my follow-up question too. That is essentially if we have any indication of biomarkers or any kind of jumping off point to look into that.
Sure. So unfortunately, in a study of this type, we don't have a lot of that. But if you look in the literature, they first would say physical characteristics. You can look at the size of microaneurysms. You can look at the development of intraretinal vascular abnormalities. And some of those things seem to have a higher risk factor of developing into either a more proliferative disease or diabetic macular disease. There are some studies, however, looking at the genetics, and so that's what I think will be very interesting going forward from a pharmacological standpoint, right? If you could have genetic markers that are correlated with certain types of signaling factors, and then attempt to either stimulate or block those, that we may be able to actually make an impact on these patients.